Every 3 minutes in the United States, someone hears the words, "You have blood cancer." The scary part. Most people miss the earliest signs until it's too late. But today, we're uncovering the silent symptoms your body may already be showing, the ones you need to catch before they become life-threatening. Stay with us, because what you'll learn in the next few minutes could protect you or someone you love. Have you ever felt a tiredness so deep that no amount of rest could fix it? Or noticed a strange bruise that seemed to appear out of nowhere? What if I told you those small, everyday moments could be the earliest whispers of something far more dangerous? Every 3 minutes, someone in the United States is diagnosed with a form of blood cancer. That means by the time this video ends, dozens of families will have their lives turned upside down. And here's the terrifying truth: most people miss the first signals. They brush them off as aging, stress, or just being run down until it's too late. But you don't have to be one of them. In the next few minutes, I'm going to walk you through the silent early signs of blood cancer that doctors warn are often ignored. You'll discover how to spot them in yourself or in someone you love before they become life-threatening. This isn't about fear, it's about empowerment, protection, and hope. Because the earlier you know, the stronger your chances to fight back. So stay with me until the end. Because the most overlooked sign, the one that could make the biggest difference, will surprise you. Let's start with one of the most surprising signs: a cough or chest pain that just won't go away. We're not talking about the nagging tickle from a seasonal cold or the ache you feel after shoveling snow. This is different. It's deeper. It lingers, and it seems to have no clear cause. What makes it alarming is that blood cancers like leukemia or lymphoma can sometimes trigger coughing or chest pain, not because of the lungs themselves, but because of what's pressing against them. Studies, including one in the International Journal of Molecular Sciences, show that when lymph nodes become enlarged, they can push on airways and create that constant pressure in your chest. On top of that, a weakened immune system makes you more vulnerable to repeated infections. And those infections can bring a cough that simply refuses to fade. Here's what matters: if you notice a persistent cough or unexplained chest discomfort lasting for weeks, don't ignore it. Keep track of when it happens, whether it interrupts your sleep, and talk with your doctor about it. It could save valuable time. And remember, a cough is easy to dismiss, but sometimes it's the body's way of sounding the alarm. Because if your immune system is under attack, the next sign, frequent infections, might reveal even more than you think. Now think about how often you've been sick this past year. A random cold once in a while is normal, but if you find yourself fighting off one infection after another, sinus infections, chest infections, even minor illnesses that linger far too long, that's a red flag your body might be struggling with something bigger. Blood cancers like leukemia and lymphoma weaken the immune system at its core. Instead of healthy white blood cells rushing in to protect you, cancerous cells take over and crowd them out. Research from Hematologica shows that patients with chronic lymphocytic leukemia are especially prone to repeated infections. And not just frequent ones, but infections that hit harder and last longer than they should. That's because your immune defenses aren't firing the way they're supposed to. Here's the takeaway: if you're catching every bug that's going around, or if your colds turn into weeks of misery when everyone else recovers in days, it's worth paying attention. Keep track of patterns. Are you needing antibiotics more often? Do you feel like your body never fully bounces back? These details matter when you bring them to your healthcare provider, because frequent infections may look ordinary on the surface, but underneath, they could be a sign of something far more serious. And as concerning as infections can be, the next sign, persistent fever and chills, takes the body's warning system to an entirely different level. Picture this: you're sitting at home, wrapped in a blanket, shivering with chills, or suddenly burning up with a fever that doesn't quite make sense. No flu, no obvious infection, just your body running hot and cold like it's fighting something invisible. That's because in blood cancers like leukemia or lymphoma, the disease interferes with how your blood cells function. Instead of creating balance, the bone marrow is crowded with abnormal cells, and your immune system is left compromised. Research in infections and hematology revealed that nearly 9 out of 10 leukemia patients reported fever as one of their very first symptoms. Think about that 90%. These aren't random fevers that pass in a day. They're stubborn, they recur, and they drain your strength. Here's the key: if your body temperature spikes without explanation, or if chills hit you night after night, don't just brush it off as being run down. Write it down, note how long it lasts, and let your doctor evaluate it. Early attention could make all the difference. Because while fever is your body's alarm bell, what shows up on your skin like unexplained rashes, bruising, or bleeding can be an even louder signal that blood cancer is disrupting your system in plain sight. Imagine brushing your arm lightly against a table and waking up the next morning with a deep purple bruise you can't explain. Or maybe you notice small rashes that don't seem tied to allergies, or bleeding gums even when you're not brushing aggressively. These are the kinds of signs many people dismiss, but they can be early warnings of something much bigger. Blood cancers like leukemia, lymphoma, or multiple myeloma interfere with the bone marrow's ability to produce healthy blood cells. That includes platelets, which are essential for clotting. When platelets run low, your body bruises more easily, bleeding lasts longer, and rashes can appear as part of the immune disruption. A study published in BMC Cancer found a strong correlation between unexplained bruising and hematological disorders in their early stages. Here's what that means for you if you're suddenly developing frequent bruises, unexplained bleeding, or persistent rashes that don't have an obvious cause. Don't just shrug it off. Track when and where they occur, and consult with a healthcare professional, because your blood could be telling a story you can't see. And while these visible signs might be alarming, what's even more surprising is how something as simple as itchy skin, a symptom most people overlook, can sometimes be the body's quiet cry for help. Now let's talk about something almost everyone brushes off: itchy skin. At first it feels harmless, maybe just dryness or a reaction to laundry detergent. But when the itch becomes relentless, when no lotion, no antihistamine, and no quick fix brings relief, it could be your body signaling something deeper. In blood cancers like lymphoma or leukemia, abnormal cells sometimes release chemicals that irritate the skin, creating an itch that won't quit. Research published in Dermatologic Therapy showed that nearly 1 in 3 patients with Hodgkin lymphoma reported persistent itching as an early symptom. What makes it alarming is how different it feels. It's not a mild annoyance, it's an intense, almost burning sensation that robs you of sleep and peace of mind. Here's what to remember if itching comes with no rash, no allergy, and especially if it pairs with fatigue, weight loss, or night sweats. It's worth speaking to your doctor. Don't dismiss it as nothing. Sometimes the smallest irritations are the body's way of screaming for attention. And while itchy skin might surprise you, the next sign, losing your appetite or feeling constant nausea, is even easier to overlook. Yet it can silently drain your strength before you even realize what's happening. Think about the last time you sat down to eat and realized you just weren't hungry, even though you hadn't eaten much all day. Or maybe food suddenly feels unappealing, and when you do eat, waves of nausea creep in. We often blame stress, a sensitive stomach, or even aging. But when these changes persist, they can signal something much more serious. Blood cancers like leukemia, lymphoma, and myeloma can alter how the body processes nutrients. The abnormal cells interfere with your metabolism, and as waste products build up in the blood, the body reacts with nausea and loss of appetite. A 2019 study in intestinal research highlighted that these metabolic shifts are common among blood cancer patients, and they often show up before a diagnosis is made. Here's what matters if you find yourself eating less, dropping weight without trying, or feeling nauseous for no clear reason. It's not something to ignore. Keep track of your eating habits and how your body responds. These small details can give your doctor critical clues. And while losing your appetite might sound subtle, what happens at night when your body should be resting can send an even stronger warning. Because the next sign, night sweats, often drenches your sleep in ways that can't be explained by a warm room or heavy blanket. Now picture this: it's the middle of the night. You wake up drenched, your pajamas soaked, and your sheets clammy with sweat. You tell yourself maybe the room was too warm, or maybe it was the spicy food from dinner. But when it happens again and again, soaking through clothes and sheets to the point you need to change them, that's not ordinary, it's your body raising a flag. Blood cancers like leukemia and lymphoma can disrupt the way your body regulates temperature, and the abnormal cells interfere with your immune system, sparking episodes of intense sweating while you sleep. A recent study in the European Journal of Hematology found that many lymphoma patients listed night sweats as one of their earliest and most consistent symptoms. Here's the key: occasional sweating at night can be normal, but drenching sweats that happen repeatedly, with no clear cause, deserve serious attention. Keep note of how often it happens and how severe it feels. Then share that pattern with your healthcare provider. Because while night sweats can leave you exhausted and unsettled, what follows during the day, persistent weakness and fatigue that no nap can fix, may be an even louder cry for help. We all know what it feels like to be tired after a long day, but this kind of fatigue is different. Imagine waking up after a full night's rest and still feeling like your body's made of lead. Every step heavy, every task a burden. Blood cancers, such as leukemia and myeloma, can rob the body of its ability to produce healthy red blood cells. Without enough of these cells to carry oxygen, your muscles and organs are literally starved of the energy they need. The result is a deep, unshakable exhaustion that sleep simply cannot fix. In fact, a 2023 study in Scientific Reports found that nearly 40% of blood cancer patients reported profound fatigue at diagnosis. That number is staggering, and it highlights just how common and how overlooked this symptom can be. Here's the key: if fatigue starts to control your days, if even small chores feel overwhelming, don't write it off as just aging or stress. Keep track of how often it happens and how it impacts your daily life. Then bring those notes to your doctor. Because while weakness can drain your energy in silence, what comes next, shortness of breath, can leave you gasping in ways that demand immediate attention. Now let's talk about another signal that's easy to dismiss: shortness of breath. Maybe you notice yourself getting winded after climbing just one flight of stairs, or you feel out of breath carrying groceries from the car tasks you used to handle without a second thought. Blood cancers like leukemia and lymphoma can cause anemia, a shortage of healthy red blood cells to carry oxygen throughout the body. Without enough oxygen, even simple movements can feel like running a marathon. Some cases involve an enlarged spleen pressing against the lungs, or even cancerous cells infiltrating lung tissue directly, both of which make breathing harder. Research published in BMC Cancer in 2023 found that nearly 44% of blood cancer patients reported respiratory symptoms at diagnosis, showing how common and yet how overlooked this warning sign can be. Here's what you need to know if you find yourself short of breath without a clear reason, especially if it lingers. It's not just being out of shape or getting older. Pay attention to how often it happens and how severe it feels. Then share those details with your doctor. Because while breathlessness can steal your energy in the moment, the next sign: swollen, painless lymph nodes in the neck, armpits, or groin, is a physical change you can actually see and feel. One of the clearest signs your body gives you is something you can actually see and feel: swollen lymph nodes. You might notice a lump in your neck while shaving, or a swelling under your arm when getting dressed. What makes this especially concerning is when the swelling is painless and lingers for weeks without going away. Blood cancers like Hodgkin and non-Hodgkin lymphoma, as well as certain forms of leukemia, often cause lymph nodes to enlarge because cancerous cells build up and disrupt their normal function. Research in the Journal of Clinical and Experimental Hematopathology confirms that persistent, painless swelling in the neck, armpits, or groin should never be ignored. Lymph nodes are filters designed to trap harmful substances, but when they swell silently, it's your body waving a warning flag. Here's the important part: if you notice a lump that doesn't hurt and doesn't shrink after a couple of weeks, get it checked. It might not be cancer, it could be an infection or something minor, but when it comes to your health, it's always better to be cautious. Because all these signs we've discussed — coughs, infections, fevers, rashes, fatigue — And now swollen lymph nodes are pieces of a puzzle your body's trying to show you. And when you put those pieces together, they can reveal the bigger picture that might save your life. So now you've heard them, all the coughs that don't fade, the infections that won't stop, the unexplained fevers, the rashes and bruises, the itching, the loss of appetite, the night sweats, the crushing fatigue, the breathlessness, and the swollen lymph nodes. Alone. Each of these symptoms might not mean much, but together, they tell a story your body doesn't want you to miss. Here's the truth. Blood cancers affect hundreds of thousands of Americans every year, and the difference between catching it early and catching it late can be the difference between life and death. That's why knowledge is power. It's not about living in fear, it's about paying attention, asking questions, and acting quickly when something feels off. If you or someone you love has noticed these signs, don't wait. Reach out to a healthcare provider, push for answers, and trust that early detection can change the outcome. And here's where you can make an impact beyond yourself. Leave a comment if any of these symptoms sound familiar, or if you've been through this journey. Your story could be the signpost that helps another viewer take action in time. Don't forget to like, share, and subscribe, because spreading awareness might be the spark that saves someone's life. And stay tuned, because in our next video, we're going to uncover the surprising foods that either protect you from blood cancers or secretly fuel them. You won't want to miss it. Until then, take care, stay informed, and remember, listening to your body is the first step toward protecting your future.